that, I'd like to introduce Fiona Duncan, who's based over in Newcastle, and she's going to be telling us about the digital asset study. Over to you, Fiona.
Okay, thank you, Joyce. Okay, about to tell about what we like to call the digital asset study. It's a study I've been doing alongside Joyce over the last 2 years, and hopefully got this thing done. So basically, the background to this study was about sort of inspired by the pandemic. So community organisations during the pandemic, in order to continue delivering services and activities, they had to make a decision. Do they stop doing any activities whatsoever, or do they innovate and try and use digital technology to keep themselves going? Now, I think, as we know, digital technology, it can support mental health and well-being in many ways. Like, it can improve access to information, facilitate, but I think, as we all know as well, it's not accessible to. In this day and age, there are still many people who don't have access to a computer, smartphone, or the internet, or even if they do have the access, they don't have the confidence or the skills, or they may not be particularly interested in learning how to use digital technology. So that led to our research questions. We wanted to find out sort of whether and how community organisations using digital technology, do they use digital technology to provide support on a regular basis? Do they actually use it? Wanted to find out whether and how community organisations using digital technology can help people form meaningful social connections and prevent loneliness. And also, is the increased use of digital technology since the pandemic, is that unintentionally leading to some groups of people becoming left behind, becoming even more disadvantaged, and therefore at a even more increased risk of poor mental health? But then we also wanted to find out the opposite. Is the increased use of digital technology, is it now some people who used to be left behind, are they now being able to be included in things that they couldn't be included in before because that technology existed? So had quite a few questions there that we were attempting to answer with the research. So for the purposes of this study, we were defining community organisations as community centres, faith-based organisations, charities, voluntary organisations. We were not including things that are connected to the NHS or a traditional health service, or any service that involves providing clinical care such as medicine or drugs. And also just had the PPIE session this morning. There's quite a lot of public involvement in the design of our study. At the start of the study, we did some PPIE panel meetings, and we recruited via the McPin Foundation. We did hold our panel meetings online due to the preferences of our participants, but we did offer to do in-person ones as well, taking into account the nature of the study. We felt we had to offer to do both. And we managed to get 18 different sort of members of our panels from all over the country. They advised us on what populations to target. They were involved in the design of the study, the piloting of the study. And I'll talk more about involved in the development of our program. Okay, so the first phase of our study, we did a survey. So this survey, so our populations of interest were older adults, so age 65 years and older, minority ethnic populations, people with experience of poor mental health, people living in low-income households or areas of deprivation, and people living with disabilities. So that's who we were sort of looking for when we were looking to hand out the survey. The survey questions. So we asked people about any digital or in-person activities that they were doing at any community organisations they attended. We asked people about what access they had to digital devices. We asked them about their digital literacy and their skills. And we also asked a lot of questions about social isolation and loneliness. And we recruited people to this various ways. We did sort of in-person completion, where we actually went to the community organisations and handed out paper copies. We also posted paper copies. and it was also available online for people to fill out there. Okay, so results of the survey. So we've got 397 participants to complete it in the end from like 29 different community organisations. So we've got people in the Northeast, in the East of England, in the West Midlands and Northwest London to complete the survey. So really quite a good response. Yeah, so the demographics of the people who completed the survey, 65% female, 34% male, and the age groups were quite well distributed. So 49.6%, so about half in the 25 to 64 age group, but then we still had 37% in the 65 to 84 age group, and 4.3% in the 85 plus age bracket, and quite a reasonable mix of ethnic groups as well, although it's still 62% white. Okay, so also we found that there were 47% people reported that they had a disability or a physical condition or illness which reduced ability to carry out daily activities, and 38% reported having poor mental health. So which we defined as any mental health condition or illness expected to last 12 months or longer. There's also quite a distribution amongst the deprivation deciles, where it's probably more skewed towards the more deprived areas, but we were sort of focusing on people from disadvantaged backgrounds. Okay, so the results from the loneliness question, 13% reported that they often felt lonely. 38% reported that they felt lonely some of the time, and 44% said they hardly ever or never felt lonely. Okay, so questions about how do people use digital technology. The sort of key bits of information there, I think, are 55% of people said that they had access to reliable internet all of the time, and 29% said access to reliable internet most of the time. So that still leaves quite a few people that don't really have access to reliable internet, you know, most of the time, and as many as 3% said they never have access to reliable internet. Okay. And how did they get the support via digital? So the digital support via community organisations. As many as 55% said that they did digitally access support from community organisations during the pandemic. And for the most part, this was social activities or online activities, but it was also WhatsApp or Facebook forums to communicate with others in the community organisation. And they also used it for to look at access information from web pages. So phase 2 of the study was a realist evaluation. So a realist evaluation, this is a research method which is used for complex real world situations. It sort of takes into account that what works for some people in some circumstances may not work for other people in other circumstances. In fact, could some interventions or could make some people worse. I think digital technology improving social isolation and loneliness is something that's very easily could be very complex, so suitable for this research method. So what we did was we started with a documentary analysis of the previous literature. We also had people from our PPIE panels feed in to how they thought that digital technology could influence social isolation and loneliness. And then what we did was we interviewed 9 service providers from community organisations and 17 service users from 10 different community organisations across the northeast of England, the northwest of London, and the east of England. And what this resulted in was 3 what we call realist informed theories about how community organisations using digital technology may be able to reduce social isolation and loneliness. So try and talk about some of these theories, but it's quite difficult to fit them into a 15-minute talk. Basically, one of the main things was recognising the importance of the role that community organisations play in the relationship between digital technology and the reduction of social isolation and loneliness. One of the key things they do is that they can provide a safe and trusted digital space for members, which means that members can confidently interact with others, access information, take part in activities. So examples of ways that community organisations can create a safe digital space is things like they can encourage supportive comments on forums, challenge or delete inappropriate comments, check profiles of every person that wants to join a forum to check that they're real. They can follow up on alarming or distressing posts. They can, during online activities, they can just create an atmosphere that there's no pressure to take part. Staff and volunteers can post photos to make more of that personal connection and to create that trust. And just more practical things like having the police come and talk to members about how to avoid scams. So there's a lot of work that we found that community organisations do to create safe digital spaces. This can help members feel more connected to each other, because if you have digital technology services and you're not creating that safe space, then that means people have to deal with trolls, scam artists, rude people, and that can just lead to feelings of disconnection and lead to more feelings of social isolation and loneliness. So another theory we came up with from the data was that community organisations can use digital technology to encourage much wider social connections. And so that creates an opportunity for people to more likely to find activities that really engage them or find opportunities that they didn't know existed. They can make friends with people who have similar interests and hobbies that they may have not found in their local friendship groups. It can be really important for people who have maybe a particular medical condition or disability to connect with others in the same boat. So it just increases that opportunity for people to find somebody that they really actually connect with at a meaningful level. And that can help reduce feelings of social isolation and loneliness. Another sort of theory we came up with was that community organisations providing services digitally can prevent loneliness in people who are housebound. So people who have mobility issues, anxiety, a chronic health condition such as a respiratory illness, or being a carer, they can't get out to any in-person activities as easily. So even though in our interviews, people said they would rather connect in person, but they said that connecting digitally is better than nothing, as they can access services, they can talk to others, keep in touch, have something to do, have a distraction. So one of the things they said was it's important for community organisations to always offer a choice, always have in-person and make sure you keep some digital services so that the people who are housebound can benefit.
Fiona,
of course, does it work for everyone?
Sorry to interrupt, but you've got 1 more minute.
1 more minute. Okay, so I think as we all know, there are lots of pitfalls of digital technology. Online bullying, scams, catfishing, grooming, spending too much time on online games, not enough physical activity. One of our participants said that technology addresses the symptoms of loneliness, not the underlying causes. They were being quite profound there, that the benefits might be temporary or limited. Making friends online could prevent you from making in-person friends, which then leads to more loneliness. And a lot of our people we interviewed just said they had doubts about whether meaningful relationships can really be made online, and that in-person interactions they believe are just better for mental health and well-being. So very much a double-edged sword. So I don't know if I've got time. One organisation put forward the idea that the digital technology is most useful maybe then as a stepping stone, or a pathway to in-person activities. So you use an online forum to encourage people to turn up to in-person activities, and maybe that's the sort of the best way to deal with the double-edged sword. So I'll finish there then with our conclusions.